Did you know that oppositional defiant disorder might not be a standalone diagnosis, especially if you're seeing it combined with anxiety or extreme meltdowns and behaviors when you are asking them to do something that is a little bit challenging? If a child doesn't have the coping mechanisms or an ability to handle stress, and we are presenting them with a challenging activity, the way that they might be coping is by completely falling apart and refusing to do the activity, because it's a lot of times it's due to their own sense of fear of failure or not being able to tolerate the pressure of the activity and not being successful. So if you're having challenges when you're presenting an activity that really shouldn't be that hard to do or something simple, but you see some opposition and distress regarding activities that tend to be a little bit more challenging, such as school or just activities where maybe they have anxiety and going out in public and they seem to spiral or fall apart, and you're seeing those same behaviors pretty consistently, it might be worth looking into that. It might be more related to their nervous system and how they're coping than it is that they are actually being defiant. And I'm going to say that the same thing sometimes can happen to ADHD symptoms, that if you have a child that is extremely anxious and overwhelmed and they are fearful, that kind of sets their brain and nervous system into a little bit of overload, and you might see a little bit more impulsivity or avoidance or forgetfulness and not really being able to focus. But it might also be just because they're feeling so distressed that their brain is kind of like, and they're not able to get themselves together to be able to focus. So what do? Work on activities to try to help them learn how to calm their nervous system. Work on regulation strategies. Work on helping them identify when their brain and body is starting to feel overloaded, whether it's their heart is beating too fast, asking them what it feels on the inside, and then just really being able to use their words to be able to communicate that, and then teaching them regulation and self-calming strategies. I know that might be easier said than done sometimes, and that's why we have professionals and therapists that are trained in this area and they want to help. So let us know how we can help you and we can point you in the right direction.